Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello there, and welcome to this week's episode of the Anti-Aging Insights podcast. Today is all about a treatment that focuses on healing the body from the inside out. And I'm thrilled to share some of my thoughts with you about prolotherapy. As you may know, my two areas of medicine are aesthetics as well as sports medicine. And prolotherapy is a type of regenerative medicine. And that is an area of medicine that has some application to both aesthetics and sports medicine. Today on the podcast, I'm going to be speaking about prolotherapy from the context of musculoskeletal or sports medicine and talk about how it can be a wonderful treatment for those people with chronic joint or muscle pain. We're going to dive into a little bit about what prolotherapy is, how the treatment is done, what is it used for, and I'd love to share with you at the end a story of a recent patient of mine because I think it's such a marvelous story about what can happen in the way a person's life can be impacted when they get the right type of treatment. So let's get started. What is prolotherapy? Well, prolotherapy, as I mentioned, is a type of regenerative medicine. It is essentially an injection, a non-surgical treatment, an injection of a solution that is made up of a sugar. The sugar, in fact, is dextrose. And when we create the recipe for what is injected, it is a combination of dextrose, a combination of some local anesthetic, similar to what you would get if you were having some dental work, as well as a little bit of saline. We mix those together in the appropriate concentrations, and that is what we use for prolotherapy treatments. So how does it work? Well, prolotherapy, or the dextrose solution, is a regenerative type of medicine. That means that it is encouraging the body to repair the tissue from the inside out. The way that happens is when you inject some of this dextrose into a particular area of the body, it creates an inflammatory response. And when you have an inflammatory response, that response is what encourages the body, the appropriate cells and proteins, to regenerate the tissue, to improve the tissue, to heal the tissue. And that is the basis for prolotherapy. It's such a remarkably simple concept, but it works really well. What specific conditions is it used for? Well, there are many, but some of the most common ones would be Achilles tendon pain, so Achilles tendonitis, or the more chronic condition of this, Achilles tendinopathy. Similarly, pain in the front of the knee near the patellar tendon is another great place to use prolotherapy. And there are many other areas where we can use prolotherapy as well. So what's involved with this? How do we actually do it? Well, the way I like to do it is I like to consult with my patients and talk about what things they have tried in the past for their pain. We determine if this is actually the right treatment for them. And if it is, then we talk about the way it works as I've just described to you. One thing that's interesting to note about this is that because it is based on an inflammatory response in the body, we don't want to do anything that would dampen that inflammatory response in this case. And that means I encourage patients to not use anti-inflammatories before or after the treatment so that we can maximize the inflammatory response. Once we decide that we're going to go ahead, then I will explain that prolotherapy is a series of treatments. It's not just one single injection, unfortunately. The way prolotherapy is most effective is by doing a series of injections over a number of weeks to months. Typically, the average person will need probably between 3 and 6 treatments. And again, they're spaced anywhere from a couple of weeks to a month apart. So a full treatment can take a number of months. When we choose to go ahead, however, I use an ultrasound probe. I can look at the tissue with the ultrasound and I can ensure that we're getting the solution, the dextrose solution, into the appropriate place. And that maximizes the efficacy and also, of course, minimizes the chance of injecting the solution into an area that is not 100% targeted to where the pain is. The procedure itself is relatively comfortable. It's like having a dental injection when we inject a little bit of the freezing. And once the freezing goes in, then it's more comfortable as well. So it's just like any other small little injections. It's done usually relatively quickly, within about half an hour, and then you're free to go home. It is a very effective treatment, and typically we are seeing patients for this treatment that have tried other things because other things are more well known. Whether it's a course of anti-inflammatories, whether it is a physiotherapy program to work on stretching and strengthening, all of these sorts of things, which are extremely important and extremely effective, are vital for treating these conditions. But if they don't work, then oftentimes prolotherapy can be a great option. Now, with that little overview, I do want to share a story with you about a patient that I had recently. This patient is top of mind, and that's actually one of the reasons I decided to do this podcast episode today, because this interaction with this patient happened relatively recently. So this patient of mine is a man with a young daughter. He used to play soccer, loves soccer, and his daughter has recently gotten into soccer, and he loves that because it's something that they can share. However, the issue is that he has had chronic Achilles tendon pain for years. He has tried numerous things and nothing has worked. And the pain is severe enough to the point that he essentially is unable to play soccer with his daughter. His daughter is often asking him to play soccer with her. And of course, there's nothing more that he would want to do than play soccer with her, but he can't do it. His heels hurt him too much. He came to see me and he told me this story, and he related to me that he has tried lots of different treatments. He's tried the physio, he's tried the anti-inflammatories and all of that sort of stuff. I told him about prolotherapy, and although he was somewhat discouraged at his whole situation, he said, look, I'm a little bit desperate here and I'm willing to try anything. So if you think it's worth giving it a shot, then let's do it. I explained to him the procedures, I've explained it to you, and we started. And I did the first treatment. He came back for the second treatment, and he was a little bit encouraged. He said there's still quite a bit of pain, but maybe it's a little bit less. And I again reassured him that that's pretty typical, that it does take a number of treatments for prolotherapy. Anyway, to make a long story short, I recently saw him for his fifth treatment. He came in with a big smile, and he told me that his pain is at least 95% gone. He has had an almost entire resolution of his pain. He can't remember the last time he felt this good. And the most important part of the story was that he is now able to play soccer with his daughter. He is thrilled. His daughter is thrilled. And they get to spend this time doing something that they both enjoy. And he told me that this has essentially changed his life. That story was so powerful to me that, again, that is why I decided to do this podcast episode. You know, the treatments are fun for me. I enjoy doing these treatments. I love doing the technical aspects of these treatments. But when I hear stories like that, it makes it so worthwhile, and I wanted to share it with you. The whole point of these treatments is not just to treat the pain. Yes, it is part of it, of course. But the point of the treatment is to help you succeed in your life, whatever that may be. And in this case, it was allowing this father to spend some more time with his daughter doing something that they love. And being able to have an impact on that is truly a privilege. And I'm so honored to be part of that journey. So I'm going to wrap it up there. I hope that story is, meaningful to you as well. If you know anybody that is suffering from any type of chronic joint or ligament or tendon or muscle pain, or if you are yourself, of course, then please feel free to reach out to me. In addition to prolotherapy, there are other treatments that in some cases may be more appropriate for musculoskeletal pain, such as PRP or hyaluronic acid injections. But regardless, of course, reach out to me at antiagingvancouver.com or on my Instagram profile or my personal website at drterifisher.com, and I'd be delighted to discuss this with you. As always, if you are inclined to leave a review for the podcast, please feel free to do so on your favorite podcast player. Of course, it helps to get the word out about this podcast so that other people can hear the messages and perhaps benefit from what I have to say as well. And finally, as always, thank you for tuning in. Have a wonderful week, and I look forward to talking with you again really soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.